first question is, what have we learned from the field about the successes and challenges of the reopening schools? In French, la réouverture des écoles du point de vue du terrain. This is going to be given by Nicola Gray. Please, Nicola.
Thank you, Didier. I'm delighted today to be able to present data from the UNESCO Chair Global Health and Education Research Group about what we have learned from the field about the process of reopening schools during the pandemic. So I've been working with the UNESCO Chair team for over a year now as a partner from the International Association for Adolescent Health. I'm committed to their work to better align health and education generally, now brought into sharp focus by this pandemic. The context was that when we distributed this survey in May 2020, many schools had closed in haste as part of national lockdown measures. COVID-19 had spread through Africa. It was particularly through Asia. It was particularly right in Europe at that time, but was only just penetrating Africa and the Americas. The value of this survey was to collect perspectives from professionals in the field, their first-hand accounts of whether and how their schools were reopening, and the successes and challenges of making this happen. We had 192 responses from 42 countries and one multi-country region. You can see that 20 countries reported that they had access to guidance with green dots. That didn't necessarily mean that schools were open, but they had access to the guidance for doing so. 22 countries were still waiting for guidance and schools were closed. And one country, Burundi, in the yellow in the middle of the map, reported to us that their schools were still open and no interruption to education at that time. We believe that this map shows a general global north, global south divide, with many high-income countries already having guidance and many low to middle-income countries still waiting. We asked the respondents to describe their guidance to us. We didn't check the documents. We wanted to know their sense of it. Most reported that there had been input from both health and education ministries to the guidance at national level. The public health priority was clear. The interrelated issues of class size reduction and social distancing were described by respondents from 17 out of 20 countries. Hygiene measures were also widely described, making sure that hand washing stations, sanitizer and plentiful water were available. Transport and canteen arrangements were also often noted. Some had moved to private transport only, meaning that responsibility was placed on parents, but others were using distancing techniques on buses by reducing the number of seats available. Regarding canteens, many were closing and remaining closed so that students would have to bring their own meals, but some were preparing and placing plates on tables rather than asking students to come to the counter. Extra cleaning, mask wearing, schedule changes, including part-time attendance or staggered start and finish times, and circulation changes, such as implementing a one-way system on corridors, were other features mentioned. We asked questions about the educational approach in the time of the pandemic and the nature of education being offered about the pandemic in schools. Several countries described materials being used. Switzerland offers a YouTube film to students about the return to school and what to expect. Iceland cited My Hero Is You, a storybook with wellbeing strategies that's been produced by the UN Interagency Standing Committee in over 100 world languages. The National Health Service in England, promoting its hand washing song there for young children. A fact sheet for older children in France, including information about why schools were closed, and an adaptation of the UNESCO Chair in Global Health and Education REBE programme, Réussir, Être Bien, Être Ensemble. This is an initiative in New Caledonia with activity sheets that could be downloaded and printed at home, including the nature of microbes and media critical literacy. So now we've moved to reports and perceptions of the process, starting with successes or levers to success. One strong theme was the symbolism of reopening as a sign that the country was getting back to normal. The level of infection was low enough to permit it, and there was a perception of safety that this could happen. At the time of the survey, respondents from some of the countries expressed relief that there had been no increase in infections nationally at that point. But the restoration of lockdown in Melbourne, Australia last week, after a spike of new cases, including only partial reopening then of schools after recent holidays, shows that we must expect the turbulence to continue. Good teamwork in schools was perceived to be very important, with reports of teachers learning fast and being adaptable in this situation. Partnerships of schools with families, local authorities and teachers' unions. Clear, consistent guidance was vital. Having that and the resources and equipment that was needed should lead to successful adoption of the recommended measures. Successes also came from the goodwill, dedication and commitment of staff. And these are all beautifully summarised by one of our French correspondents: political commitment of communities, creative spirit of teachers and principals, anticipation time, partnership, inspiring and guiding resources, and not least, the opportunity to exchange practices between schools, learning from each other. Regarding challenges, in some ways it's the mirror images of the successes. The most widespread challenge reported was safety concerns and the resistance to reopening. The word fear was used frequently, leading to significant absenteeism of students and staff. Lack of time to prepare, a lack of resources, a lack of equipment. Logistical issues, problems within school premises. So, for example, corridors that were too narrow or classrooms that were too small for social distancing. Concerns that education would suffer at that time. Many recognised that students may only be in for several days a week rather than full-time to create those reduced class sizes. The challenge of hybrid education, some students face-to-face, some still on virtual platforms at home, was also reported to us. Contradictory information, communication challenges did not inspire confidence nor help people to get ready. Mental health problems among all groups, staff anxiety and fatigue, but also for students and families. And then that lack of consultation, lack of local empowerment, lack of trust. So again, a mirror image of successes. A super summary again here from a correspondent in the United States. The increased but necessary burden of extra disinfection, managing social distancing by scheduling or space reorganisation, communicating with parents, managing school meals, mental health problems, keeping staff safe and finding protective equipment. All these problems very much in people's minds and shared with us. Among those 20 countries who gave extended responses about waiting for guidance, they shared their insights, hopes and concerns about what that guidance might contain. And they could anticipate what would be in it because their countries were providing public health education more generally about the pandemic. For example, I remember a response from the Republic of Ireland about a Be Media Smart campaign to combat fake news. Many of these respondents were very keen to reopen schools. They recognised that conditions were not ideal for their students at home. A response from India, for example, noted that only 50% of families had adequate access to the internet so that they could take advantage of those virtual learning options. They were worried about widening gaps. There were practical concerns on this particular point that the guidance would come out just before the reopening, and so they would not have time to consider it fully and to implement all the measures in the way that they wanted to. So they wanted clear and flexible guidance, adapted to the local context, and to be able to learn from other people's good practice. A regional correspondent from Latin America shared a concern about young people not coming back to school. The economic impact of the pandemic could result in adolescents being sent into very unstable work markets to bring income into the home. A summary from India here underlines the need for clear and adaptable guidance, clear roles and responsibilities for all stakeholders, checklists, and the sharing of good practices by places that have already reopened. So, our reflections. The guidance prioritises public health and hygiene measures, arguably with less emphasis on the educational impact and consequences. Cooperation between local stakeholders is vital for success. National guidance must be operationalised at the local level, and we need people to buy into it. There were scarce mentions of local health providers, Only our French respondents mentioned school nurses or paediatricians. So from my healthcare perspective, I wonder whether healthcare providers who know those schools and know those families locally could be good resources and good advocates. The long-term impact of widening inequalities for children and youth if education is disrupted is an issue. Resources have been variable in terms of information and its consistency, but also in terms of equipment that is needed to implement measures. And sharing of good practices is needed, to which end we hope this survey has been a meaningful contribution. Thank you.
Thank you so much, Nikki, for this talk. It's a brilliant summary of what we learned from the field and from the people in the different countries.